today. Kingsley is on the line. He'll be monitoring the chat and answering any questions that we have. So today we'll be talking about a checklist that we've pulled together to assess digital maturity and readiness for SRS design and integration. Like Patricia mentioned, we know that these are topics that have come up a lot as you undergo your planning grants. Um, this is a draft of information. So everything that Kelsey sent out yesterday is in draft form. We're talking about it today as a draft. We want feedback. There's a lot of other ICT technical assistance work that is either going to be done to this checklist or to other ICT related components, but we wanted to get something out very quickly so that you have information to work with over the next few months as you finalize your proposals and your cost of action plans. So we have a checklist that we are talking through. You have a copy of the checklist in draft form. So I will say this again as we get to later slides, but we have slides here that talk through all of the questions on the checklist. You do not need to screenshot any of this. You should have it all in your email. So we've pulled together a checklist to assess digital system readiness for use in your SRS proposal. So it's focused on both how do you gather the information that you need to develop and plan for your SRS IT systems, as well as what information do you need to integrate those SRS ICT systems with other related systems that may or may not be in use in your country. We're hoping that this checklist will be out of draft form sometime in the next month. And well, I already talked about presenting it in draft form, and we already circulated draft versions. So you should have all of this information. The intended workflow for this checklist looks something like this. So we have the SRS planning grant teams working with your TA partners to use a set of tools and frameworks to complete your ICT checklist. So the checklist document itself that Kelsey sent out this morning or last night, I don't remember, has a set of questions in it. And at the back of that checklist, there is a table listing tools and frameworks that you could use to answer all of those questions. I'm placing emphasis on the could use because for some of these questions in the checklist, you might know all of that information now. If you know all of the information and you can answer it today, then you don't need to use any of the tools and frameworks because you know it already. Where we've pulled together a variety of ways to gather that type of information and maybe types of people to engage to get that information in the event that you're reading a section of the checklist or a few questions in the checklist and you think, this is a great question, but I don't know the answer to it. So you work through the tools and frameworks, you answer the ICT checklist questions, then what do? The ICT checklist itself is not the final product. We're all working towards an SRS proposal and a cost of action plan. So the vision here is that the answers to your ICT checklist questions can help you design your SRS ICT components. So what do you want the SRS software and hardware to look like? How does that launch in your country? How does that integrate with other systems in your country? So you're using all of this information in the checklist to try to develop whatever you want to do. There's that ICT TA as needed that can pull in at that step. So that could be help from me, help from Kingsley, help from any other people in this TA support mechanism who can help design that SRS proposal ICT sections with you and provide expert input. So the checklist is, in summary, really a set of guiding questions that should be considered when planning for SRS ICT. It's an entire resource available to you and your TA partners as you complete SRS planning grant activities, and it's currently available in draft form. It is not a prescriptive definition of how SRS should be planned, ICT should be planned and designed. We're not saying anywhere in the checklist, you must have a system that does this, and it must be built on a Python back end, and it must integrate with all of these other things. We're not saying that. We're trying to give you building blocks to put that together and design it however you see fit for your program and your country. The checklist is also not a method to evaluate or rank countries against each other or in any way determine the ultimate success of the proposal. If you've opened the actual checklist document, you'll notice that it's currently formatted in an actual checklist form where there are boxes and you can tick them off as you go. What we're trying to say here is if you have answers to all of the checklist sections and you've checked off every box, that does not necessarily mean anything related to the ultimate success of your proposal. And also, crucially, the checklist is not in any way required. If you have another way of planning for ICT and developing these inputs, and you don't even want to open the checklist document, that is completely fine. So the rest of this presentation is we're going to go through all of the different checklist sections, and there are 7 of them. And I'm going to not read you the questions, but I'll give some time on each slide for you to read the questions on the slide, and I'll provide some summary information. And then once we get through all of that, we will just talk about upcoming ICT resources. And then if we have time left, I'd love to have discussion and hear thoughts from all of you because, like we've said a few times, this is in draft form. We also have not really had a chance to circulate this amongst many of the TA partners until today, just based on how timelines happened. That was the original schedule, but the schedule moved a little bit. So we'd love to hear thoughts and comments from anyone on this call if we have time remaining. So some of these items here are probably familiar to some of you. We have organized the checklist sections according to the WHO Digital Health Environment Enablers and Building Blocks. So there are 7 sections, all of which have a variety of the checklist questions attached to them. So the first one is leadership and governance, thinking that strong guidance, strong structures, understanding who the leadership is will help coordinate the digital health activities and really set SRS ICT up for success. The second one is strategy and investment, understanding what's the roadmap for SRS and SRS ICT, are appropriate resources allocated towards that strategy, both for launch and sustained maintenance to ensure success. The third is services and applications. So this really focuses on the tools and programs specific to what we need to do, both designing those tools to support your SRS business process maps and your SRS activities, as well as understanding what other services and applications exist that SRS needs to either be aware of or maybe directly integrate with. Whoops. 4 is standards and interoperability. So this is really focusing on any established standards, whether internationally accepted or established in your country, to facilitate data exchange and communication. So we've talked a lot, and Kingsley is a real expert on integration between systems and designing those points. That's really where this comes in. Infrastructure is focusing on hardware and foundational digital architecture to enable all of this to happen. So do you have plans for servers that have stable electricity? Because if the server keeps going down, then the whole system crashes. 6 is legislation, policy, and compliance. So what is the regulatory framework in which SRS and SRS IT operates? How do we focus on privacy, security, and ethical use of the data that we are collecting? And 7 is focused on workforce. So we really need a skilled and trained and stable workforce to support all of these tools and all of these programs, both if you think about kind of data collectors going out in the field, but also IT staff at a central office to provide continued support for systems. So these are the checklist sections. We're now going to go one by one, and I apologize in advance because the slides are a little dense, but what the slides are effectively just the checklist sections and the checklist questions for each section copied out of the PDF document. So You do not need to kind of answer these now. You don't need to screenshot these. But what we'll do is I'm going to set a 30-second timer for each slide just to give you a chance to look at the questions on them and think about them in the context of what you are doing. And then I will provide some overarching thematic questions. I'm not going to read all of the questions out loud um, because I think we'll be here for 45 minutes just doing that. So, leadership and governance. I'm going to give 30 seconds for you just to read all this text. Okay. So if you're not done reading, that's fine. But the key themes here for leadership and governance are you need to define your SRS lead institutions, define any relevant steering committees, um, identify a digital health strategy if one exists as it relates to SRS, and how does SRS and SRS ICT relate to that digital health strategy. Um, Also of critical importance is the third question here, not the third question. The fourth question, understanding leadership points of contact. So this is a deeper question than understanding just kind of what organization owns maybe the CRVS process, but really if a software developer or someone designing the ICT system has a question about verbal autopsy implementation or field work, or how deaths are registered as it relates to what they're building for SRS, and if they need to pick up the phone and WhatsApp that person or call that person, do they know who that person is? And also, will that person pick up the phone? Without understanding those clear leadership roles here, there's probably going to be a lot of back and forth and trying to redefine things. So understanding all of that up front as it relates to leadership and governance will help to design a system and best ensure success. Strategy and investment. So we're going to do the same thing here. So I'll give 30 seconds or so just to read, and then I'll provide a summary. Okay. So strategy investment really is related to leadership and governance. It focuses on really long-term goals here and goals as they relate to SRS. So is the budget and proposal for ICT related activities um, is it in alignment with those long-term goals? And is there a dedicated budget? Is the costed action plan appropriately sized for ICT, both for initial development and launch, as well as any follow-on sustainment, maintenance, because we all know that's how many times all of us have tried to call a help desk or we log on in the morning and our laptop doesn't work. That help desk needs to exist for ultimate SRS success if we think have a long-term, multi-year programmatic sustainment type of view. Um, what coordination from a strategy perspective needs to occur between the donor, partners, and government as it relates to the SRS platform and infrastructure? And can any of those planned digital health innovations support that coordination in any way? So if you're maybe already using a certain system or something, does that create a stronger link between your program and a certain donor or another program that has real strength? And also the last question here focuses on fragmentation or duplication. We don't want to continuously be building new systems that all do one type of thing. So is there any way for strategy and investment that we can get around that? Um, so I see I have the chat up, and Williams, I see your question here. So let me read that out loud. So can you speak a little more about the last point on risk, given that many countries have multiple systems? Are we interested in leveraging existing systems? Um, I think this is a very fine line to walk. I think the answer to leveraging existing systems is probably yes. I think we never want to be in the mindset of building a totally custom system for every program that we want to launch. In past experience, though, and Kingsley, I'd like you to weigh in on this as well if you're able to. Um, the risk that we run by sometimes it's easier when there's a lot of partners at the table and a lot of different organizations at the table who have built a system that's really, really good at doing one thing. Sometimes it's seemingly easier at the beginning to just build another system that does exactly what you need to do for SRS ICT, and that might be highly related to the thing that this other system does, but it's not exactly the same. So you can't take that system in its entirety. Um, and sometimes politics and relationships and things get in the way where it's just easier to do it yourself and build another system instead of leveraging that other system. Um, that is probably an acceptable answer here for SRS if that block is really very large. But we need to just be aware that there are then two systems that maybe have a significant amount of overlap, and maybe data is very similar in one question or one system or another system. I think we need to, this question here is really making sure we understand those considerations, and then a decision can be made to address that. Kingsley, do you have anything to add?
Yes, thanks so much, Matt, for the explanation. And William, thank you for asking this very important question. Yeah, in addition to that, like you said, risk that exists also in fragmentation and duplication also includes duplicative investment, right? Several donors or partners will be doing the same efforts in different settings if geographical definition of where the implementation happens differ. Again, it also leads to poor data quality and use. You are collecting the same data in different systems, and it becomes difficult for you to bring the data together. So, in the setting of SRS, you really want to avoid this risk so that you are not duplicating effort in terms of investment. You're not also duplicating effort in terms of data collection related to mortality data. Over.
Great. All right. Um, I'm going to move us along, but please feel free to write questions in the chat. We'll monitor them, and there will also, to Miriam's note, thank you, Miriam. We will have Q&A time at the end.
But Matt, do you want us to talk about are we interested in leveraging existing systems?
Sure. Do you want to answer that?
Yeah, I would say that that really will go back to the countries. Each country has to assess the system's readiness and maturity to also understand the system that exists in your country, whether you'll be interested in leveraging them. Again, there are also some best practices that I know soon will be shared from Zambia. If Zambia's SRS system is something that countries will want to adopt and adapt, that would be great for them to look at. I know Mozambique has also done something. Countries like Zambia did in the past, they went to Mozambique, learned from what they did, and also decided to adapt it and also structure it to their particular use cases. And I know in the subsequent slides that may follow, we're talking about use cases. So some of these questions can also be emphasized further.
Perfect. Okay.
Very good
Ulrike.
question. Okay, go ahead, Matt.
Well, I was going to move us along. Kingsley, do you want to answer that?
Yes, so that's a very good question, Malik. How do we define system maturity? So, um, how WHO and some of the global best practices have defined system maturities, but let's stick to how WHO is defining it here. WHO is using the WHO enabling blocks, the digital health enabling blocks to define system maturity and trying to understand this sections that Matt had earlier presented to understand where countries are. In many of the digital health maturity that has been done by WHO and some of the global partners, especially if you go to Atlas, which is a repository where you see most of this digital maturity assessment done. They usually do it on a scale of 0 to 1 to understand where countries are. But we are not trying to rank here in SRS we are just trying to use this framework. We have adapted this framework to guide countries in some of the critical consideration that they can use when thinking about system maturity. But there is really a global best practice and also a clear cut of assessing system maturity, which we can talk about in future discussions. Over to you, Matt, if you have anything to add.
No, I think that's perfect. But I'm taking note of all of this, and I think it's great that this is being recorded because these are the types of questions and types of things that when we continue to revise and finalize this, I think we need to get in this document or another ICT related support technical assistance document. So thank you. I'm going to move us along. This is a great set of questions so far. So services and applications, building block number 3. I will give 30 seconds and then I will summarize and we'll answer any questions that come up. Okay. So as you keep reading, services and applications really focuses on the software itself. And the first set of questions here really focuses on what software already exists, which of those systems are digitized, which of those systems are not digitized. To the discussion that we just had, what tools are already in use to support those systems in country? Are there already any amount of like national data warehousing systems set up? Where does all the data go? This is all focused on information that already exists in your country. And then the last set of questions here takes similar questions here and focuses on SRS itself. So are there systems or platforms that you want to adopt to support SRS implementation? Is that maybe kind of, are you leaning towards adopting a system that already exists? Do you want to change a system that already exists? What are the use cases and target users of your SRS system? Because whatever ICT tool you develop must support those use cases and must support the data services and analytical tools that are designed. And then the last bullet here is really focusing on the scale of the SRS system. So do you want it to be really focused for very technical users? Do you want it to have a very kind of broad base where maybe an epidemiologist or a system administrator can log in and see information? Do you want it accessible on a phone? Do you want it accessible just on screen? All of those questions need to be thought about at this point. So I see a question in the chat from Zach about how easy or accommodating it is to add additional needs of SRS to an existing digital system versus establishing an SRS specific digital system. This is probably one of the biggest questions that you're going to run into. And it really depends, in my opinion and experience, and I'd like to tag other people in. I know we have at least people from Mozambique here. I know Malik's on, Kingsley can add to. But This really depends on the scope of the SRS program that you're establishing. So in the Zambia case, they already had a VA, a verbal autopsy program being run at MOH that structurally was quite different from the SRS program that they decided to implement, but in terms of data elements coming in and data flow, actually quite similar. So Zambia was able to take existing tools that they already had and modify them. It's still been a bit of work. I don't know if Moya's on the line and he wants to share, but it's still been a set of developers doing development for a number of weeks to months trying to add functionality to the tools to configure it for the SRS workflows. But versus building a brand new system from scratch, that's much, much smaller. Um, However, if you're developing an SRS system that is conceptually entirely different, it's probably going to be easier to just start a new system. So it's that question that you need to kind of do a scan of existing tools and see how it fits to the SRS use cases to determine which way you want to go. Does anyone else with other country experience want to weigh in here? Okay. Hearing none.
I can.
Oh,
I think
perfect, Malik. Thank you.
it's really difficult for countries really to try to change or add module in their current system when they are running. Even if you go to Ministry of Health, they have many programs and many systems that run their own, own programs. Now, you can say you want to add some module, complete the systems. Really, it's really difficult. Um, the easiest way, as you said, is just to start your own modules, have your own system running to make sure this system runs smoothly. Then after you can see how you can integrate your system into the Ministry of Health or the country system. Sometimes it is really the easiest way. But country, they can discuss with what they have in countries. As you mentioned, the case of Zambia that already have a system, they know and just try to use that system to integrate this thing. But I think we have many countries here. It's their work to really see whether the current system they have can accommodate other variables or other modules that is really specific to uh, like the SRS. If it is not possible, they have just to develop their own system or the way they want, and later on try to see how they can move the SRS data in the platform they want, like what we are doing in Mozambique, for instance, with the DHIS2 module. The DHIS2, it's really rigid system, and you cannot just come and start building a new things and change it. So in Mozambique, we decided to move the way it is, then just add a module for the DHIS2. This is the same way for the CRVS. You cannot come and just try to change the eCRVS for any country. So I think this is really the country team has to discuss with what they have and decide whether this is possible or not. If not, I think the easiest way is to build their own system and move on. Thanks.
Fred, do you want to respond?
Hi, Matt. Yeah, I just wanted to add there. So I'm Fred Van Dyke. I worked with, Malik on the Mozambique project, and then I've been, trying to support Zambia in their efforts to establish their system. I think Malik's right. I agree with that. I think it's a little vague when we're talking about systems and, like I think there was a question in the chat, do we have any models for this? Because you're talking about a lot of different pieces at once. If you kind of oversimplify it a bit and say, okay, we have the data collection, we have the data processing, and we have kind of the presentation or sharing of the data. If you took kind of those three pieces, I think you're likely to have, similar systems that look a little bit similar in each of those areas. So maybe your team has experience collecting data using certain technologies. I don't know, ODK or REDCap, you might say, okay, we want to use similar technologies. It may not be the exact system, but we want to align with our team's capacity there. The system for an SRS is pretty different than like a system that runs through hospitals or healthcare centers. So you're probably really starting with a new system, but there are going to be elements you can use from your team's experience. And then the data processing, I think in Zambia, like Matt was saying, they have a really strong kind of existing system. It's not a perfect fit for processing the death data. So they're able to leverage that. And then that third piece, I think, where you're talking about sharing the data, making it available to different agencies, making it understandable. You're mainly trying to take your SRS data, your results, your cause of death, and shape it to fit into another system. So you're trying to just, I think you're in that area, you're kind of making your data available for other systems and trying to see if it can be adapted into like DHIS or other systems that your Ministry of Health might use to kind of understand what those causes of death are through the country. It's not a direct answer, but I'll pause there.
There's some great discussion going on both verbally and in the chat. So I agree with everything that's been said. We are not planning on recommending a system and saying this is the system you should use. And that's because, like Malik said, like Fred said, every system is going to be slightly different. That's why answering all of these questions in some type of framework to gather input, outline roles and business processes is so critical, because for a software developer needs to understand how the system is going to be used and what the system will do.
Okay, thank you. All right.
And on the other side of things, for the systems that have already been developed, in many ways, there are pieces that can be leveraged, and that could be through standard API calls to run services to assign cause of death. That could be, you can pull like different modules from different systems together. So I don't think we also need to focus on the system. We need to focus on steps that need to be complete in your country, and then maybe a whole system works for that collective set of steps. But probably what is more likely is going to happen is we need to pull the service that codes cause of death from here and the scheduling system from the Mozambique COMSA system, and then kind of integrate things together. That's probably more likely what we're looking at. But again, we're not necessarily prescribing this. What we're trying to focus on now is information that needs to happen during the planning phase, to try to help you answer these questions and understand what type of system needs to exist. We're moving a little bit in the discussion into actual implementation, which I think is good. We need to have a longer term view, but I want to put that guardrail there up. We are, as I mentioned very early at the beginning of this presentation, this is one of a series of ICT-related technical assistance documents. And one of the things that we are planning on doing is building out a more detailed playbook. There's a slide towards the end of this that talks about it a little bit, but tries to frame some of these questions in: what software did Zambia use? How did they develop that software? What did Mozambique do? So that you can try to gain an understanding here of what did the other countries do and what building blocks might exist for you to pull from. Okay, I'm going to move us along just so we make sure we get through all 7, hopefully. So continuing down we're getting more technical from a software perspective, and then we will get less technical after this one. So 4 is focused on standards and interoperability. So I'm going to stop the 30 seconds in an essence of time, but I'll let you read this while I talk. So standards and interoperability is focused on, for the variety of software tools that we just discussed, do they need to communicate with each other? And what is that data sharing strategy? That strategy should not be defined by the tools themselves. That should be defined by someone in, or a group of people or a committee in SRS planning thinking strategically, we want to link SRS with CRVS and SRS with any other system. Do we want to integrate the health information system into this, or the health records? Do any of the existing systems that you're already looking at in your country, do any of them already integrate with each other? And if they do, what APIs, what data sharing frameworks, what standards are already in use to do that integration? It's probably going to be far easier for you to integrate with SRS into other existing standards and things that you already have in country, as opposed to redefining something from the ground up. Should the SRS information platform exchange data with these systems? How will you maintain metadata in a data dictionary? And ultimately, what data standards, what interoperability frameworks do you want built into your SRS system? I think it's also important to note that some of what we're talking about here, as you envision your perfect SRS ICT system, is not what you need in your system to launch. So you might be in a situation where you're envisioning a system for SRS ICT that does all of your SRS operations and digitally links to CRVS and digitally pushes data to the National Data Warehouse and all of these defined standards. But that may be a vision for a fully mature, to Malik's point, SRS ICT system that will take years of pilot and additions to work on. So also, what do you need to launch versus what might you need 5 years down the road? Okay. We'll move on to number 5. So this is focused on infrastructure. We've talked a lot about software. We've talked a lot about integration. We've talked a lot about what tool you're going to use. Infrastructure is really focused on both foundational electricity, things like that, but also hardware. So will your data collection be fully digital or some hybrid form? If it's digital, where are you storing the servers? Are you using a cloud server? Are you using physical servers? If you're using physical servers, are they stored in a place that has stable electricity and stable internet? Do you have devices, tablets available for field teams if you're conducting digital data collection? And really the last one is, how will the SRS program writ large ensure a secure environment, a resilient hosting environment? Because if you build a system and it's perfect and it has all of these integration links and you define the interoperability, but the electricity causes the system to go down once a week, then people will stop using the system and then the data get lost somewhere in the middle and you have data coverage issues. So what is the plan to ensure uptime and also address problems when there is downtime? How quickly can you get the system back up? Okay. Like I said, we went really deep technical, now we're backing up a little bit. So legislation, policy, and compliance, what legal provisions exist within your country that you need to, one, be aware of, and two, comply with. So are there data sharing policies, data retention policies that apply to SRS? Do national laws support verbal autopsy and community death reporting? And then from a privacy and data protection and ethical perspective, how will you design an SRS ICT system that protects all of those things and complies with relevant policies and procedures? Going back to the tool and the system discussion that we just had under services, the systems that are maybe available as models and maybe have code for you to borrow from comply with legislation and policy within their country, which may or may not be the same legislation, policy, and compliance within your country. So this is an example of where taking a tool that might work well in Zambia might not work well for you without some assessment and or modification. Okay. Last category is workforce. So this is really focusing on people and support. So what roles are needed to operate and sustain the SRS? I know that this is a key component of SRS program design. How is that workforce going to be trained to operate and maintain the digital systems at all levels? So what will the statistician's login role look like into the system? What will the data collector's login role look like into the system? And how will they be adequately trained over time to both maintain the system, but also maybe understand how to troubleshoot? Speaking of troubleshooting, what is the both short-term and long-term plan for IT system admin? So we need to launch the system, we need to develop the system, but what's the plan after that? If I'm someone in the field collecting data and I have internet, but I can't log in and I've gone through all my troubleshooting steps, is there someone for me to call at any time of day? Will I just not be able to complete that interview because I can't get into the system? What happens? If we really are focused, if we think about the goal of this program, right? The goal of this program is not to build a cool software system. The goal of this program is to gather usable data. And the software need to support that gathering and use of data. So if the software don't and I can't call anyone, then that's probably a problem. Okay, so we've moved through the 7 checklist sections. Like I said, in that first workflow diagram, we're also offering a set of tools and frameworks with which to gather information for these checklist sections. So that's what this is. This table exists in that PDF document as well. But how we're intending use for this is we had a lot of questions here about number 3, services and applications. There was a lot of great discussion there on what tools to use, how to build the tools. We've offered 2 possible frameworks here for gathering requirements, understanding how those building blocks fit together. Williams, I see your comment in the chat about assessing system maturity. I don't know if there is one here, but that is an excellent comment, and we can add it to this list if it's not here already. But things like that, right? Like the question of how do we assess maturity? That's what these frameworks are designed to do and help you answer some of these questions as you start to put these pieces together. Like I said at the beginning, they're not prescriptive. One framework might work better for Senegal and one framework might work better for Ghana, and that's okay. So what's coming next? I'm going to wrap this up and then we'll save about 10 minutes for further questions and discussion. So we're targeting September or so for a revised and finalized version of this checklist. And then, like I mentioned, we're also working to build a more detailed playbook and integrate all of this within the existing set of Viva resources that will try to there's a lot of information about this out right now, try to incorporate, integrate, and deduplicate across ICT information, add some case studies based on existing country experience. So for one of these steps, what did Zambia do? How did that differ for what did Mozambique do? Maybe you can learn from one or both of those case studies. And then also provide some implementation-focused tools and templates. So for example, if you need to define IT user roles, we'll hopefully in this playbook have some tools that you can use, like paper-based tools where you can draw and gather information on IT user roles. And what does a software development cycle look like if you've already identified building blocks and you need to put those software components together into your final software. That's what we're envisioning for the playbook. So we have some contact information here. This work so far was put together by Kingsley and myself, mostly Kingsley, so thank you to him. We have contact information here, so feel free to either reach out to us directly or go through your TA partners. If you can't remember our names, that is also perfectly acceptable. But for the discussion, and this could be for the next 10 minutes, but also for later on, because like I mentioned, this is still in draft form. We'd really like information from you along these 4 categories. So questions, comments, clarifications, reflections on the checklist itself. Is it doing what you need to do? Is it addressing needs you have? Are there other needs that you think you still have that we're not addressing? And then focused on next steps, we'd love to hear how this is helpful, really, because ultimately we are a set of TA partners. We want to produce resources that are helpful for you. And like I mentioned, we have a lot of other work that is continuing along this path, and knowing what works and what doesn't work will help us make sure that we fill the holes and make sure you have what you need to get your proposals in. So with that, I will pause. I know we have 8 minutes left. We can just throw open the floor for questions, comments, discussion, feedback, anything that is on everyone's minds.
Yes, please. Anyone, if you have questions or comments, feel free to unmute yourself, raise your hands, or put your question in the chat.
Yeah. Hello.
So this is Samba here. I would like to congratulate you for a great presentation. And we've been listening really carefully, and such a great pedagogic way to give us 30 minutes to read your slides. But even for non-English speaking people, it's very helpful. Thank you. And I really happy to hear some of the thought you mentioned there, like trying to come up with something that we will kind of implement first, or pilot first. Maybe the word pilot is not the right way. We'll do it first, and then at some point we will see how we can better help to sustain and share with the country. That's the best way to go. And 2, try to really work with the country's system and work from the existing platform, see how we can integrate things. So that integration is key. We really, really do not need to reinvent the wheel and set up a vertical system. So I think that's what I'm understanding from your presentation. No verticality, integration, and working with existing platform and strengthen and improve the existing platform and the existing system. And last thing that I want to say, that for Mali, for example, you cannot go collect data in people, even if it's a national census. There is now a law that you have to follow, get some type of special authorization from social offices that you have to have. So you mentioned that, and that is true for us. We have to get those. And at least, even if we may not need IRB approval, we have to at least keep IRB informed, and also keep some of the key partners, in addition to the Minister of Health, the territory administration and territorial minister and interior minister, those must be informed as well, in addition to the authorities that are requiring to have special authorization to go door to door, house to house, and collect people information these days in Mali. These are some new rules that are just coming up, and we are working on that already. And in terms of special people, we also have some special really leads, like focal point, who will, are already identified. We're just working on formalizing those positions. And thank you again for your great presentation.
Thank you. Murga, we have a hand.
Hello, everybody. Greeting. This is Marga from Ethiopia. Thank you for the nice presentation and detailed experience sharing that you made so far. So I want to hear if there is a lesson from each country that the SRS is linking with existing system, maybe the HIS2 and the HIMS. You know, sometimes the SRS has been collected from the community level, and the clinical data might be here and there. So when we are talking about the interoperability, what we mean that, do we mean that individual linkage from the clinical perspective and the community level linkage, or what we are considering while we are talking about SRS? In the same way, also there are different database modality which might be keep the relationality of the data like that of longitudinal system. So do we consider that the SRS is a longitudinal types of data collection method, or just it is a flat form, or that is survey types? Which one is the clear demarcation between longitudinal and SRS point of view? Thank you.
So I know I heard in the first part of the question asking for other country experiences. Do we have Zambia or Mozambique or anyone on the line who wants to share that?
Hi, Matt. It's Red. I can try and answer that a little bit.
Go ahead.
So I think if you're thinking of the SRS, you're thinking of, I think the question was like, is it a platform for surveys, or is it more like a longitudinal system? I think of it more like a longitudinal system where you're monitoring these communities. So you do have, your data accumulating over time, and you have past years, and you have to think of your cycles that you're using for presenting the data when you're sharing it to like a DHIS system. I'm not sure I got the first part of the question right, but I think it is a different shape of data when you're talking about community-based data versus this clinical or health-based data. So if you're putting it into one of these health-based systems, you really need to provide the context for that data so that someone opens up the system, has access to it, can understand that this is a sample of data. It's not like a comprehensive number of deaths that occurred in a certain area. It's meant to be a representation that you can use to model these kind of large-scale deaths. So that context is really important. But a lot of good thinking there. If I misunderstood the question, please rephrase it again.
Yeah, my point is about interoperability of different systems. Maybe if I can take the data that has been collected by clinical point of view and also SRS are different, just a different perspective. So if we can try to link this both element, do we have any practical activities that you pass through, or what we consider, what is the linking point, how we can link these two different data sets to have a clear picture of health system in that country? That's my point. If I understand it very well. Sometimes we have a clinical data in different data set, and also we have SRS data in different data set. So we suffer to link sometimes. So if you have tried such types of practice, I wanted to hear that. Sorry.
Yeah,
So-
maybe Malik can comment on that or someone else, but there are different types of data there. So they're not great for, maybe they can be used to validate each other, but it's hard to use to combine the data in that way, I would say, from those systems. But let someone else comment.
Yeah, so
Yeah, it depends to the type of linkages you want. I think for the case of Mozambique, what we try to do is to have the community data, not the individual record to be there. but at least the community data and the province level data to make sure those data can be shared with the Minister of Health, having a new module that was generated from their data choice 2, that we share the data every, I don't remember, maybe every 3 months, that we share a new data that are coming from the community level, like at community level data, if I'm not wrong. I don't think we share like individual record. There are some individual record, but we make sure that those are the identified data, and it's difficult for them to go and find this right person and discuss with them unless there is need for the country to ask for that. But overall, it is like a summary data that the country will access. And if they need more data, we can work with them to share those data as needed. Over.
Yeah, just wanted to add on that. So while you want to do your integration and interpretability, there are also some key considerations that one needs to put in place. This is kind of a general best practices and not only related to SRS. So once you, first of all, you have to define the objectives of your integration or interpretability, especially around how you want to integrate. If you want to integrate at a point of data collection, then there are some structures and processes that you want to follow. If you want to integrate at a point of data analysis, that is, if you want to integrate aggregate data, then there's a process and steps that you have to follow. So it is very important for you to define these use cases. And in doing that, like we are presenting today, you also need to understand the current systems, their features and functionalities, what the systems can do. Are they API friendly? Do they have interpretability layers to be able to exchange data with each other? And also put your end users in mind. How do end users want to access the system? Is it from, for example, from the SRS system? Do they need the data in a portal? All this will help you define how you want to integrate or interpret the systems to be able to have the data at one place for use.
Thank you, Kingsley, for that comment, and Malik. I'm afraid we've run out of time for private questions, but thank you very much to both Matt and Kingsley for preparing the fantastic checklist and presentation. I think would like to reiterate that this is not an end product, that we are really welcoming questions and comments and feedback. So as Matt said, please feel free to reach out directly to them, to Matt and Kingsley, or otherwise to your technical assistant partners, and they will put you in touch with them. Really, every feedback is welcome. But nevertheless, thank you very much to both of you and also to everyone who joined the webinar. I believe it will be uploaded to the Viva website as always shortly. And I apologize again for the slight delay at the beginning due to some internet connection issues. Thank you, everyone, and see you on the next one on the 25th of August.
Thank you, everyone.
Thank you. Thank you.
Thank you. Bye.